Alright, so today I'm going to be doing my presentation for catheter insertion. So I chose the kitchen because it's a little bit cleaner for the moment. So I got a little start to my setup here area. Let's give a quick look around all the room. Got my little display here, everything I'm going to be using. And don't mind the living room, kind of a mess right now. Alright, so just going to get the camera here in position and we'll get started. Alright, just as I'm walking in the patient's room. Hi there, my name is Josh and I'm going to be your nurse for the day. Just quick wash my hands. Alright, so can I get your name and date of birth, please? Alright, thank you very much, Mrs. Peabody. Alright, so today we're going to be doing a catheter insertion. That's basically where I'm going to be putting a small tube into your urethra, which goes up into your bladder, and then it'll allow it to drain the urine from it. Do you have any questions before we get started? No? Okay. Well, thank you for the permission. Alright, I will go ahead and get started. So, I'm going to first grab a couple gloves here. Alright, and now next I'm going to do is get some water and this mild soap, or just basically clean out the perineal area. First what I do is I'll give you a bath blanket on top. I'm going to take down the blankets that are underneath now, and then I'm going to lift up to expose from the perineal area that I'm going to be working on. Alright, next I'm going to use the water and the soap to use the mitt technique for a cloth towel, in which case I'm going to be wiping the sides, but only using one side each time, each swipe. Alright, and once it's all clean there, I'll dispose them in the correct laundry facilities in the garbage. Gloves come off. Alright, form another little hand cleansing sanitation here. Alright, so I'm going to get started. This is going to be my overhead table. I know it's a little bit different heights, just using what I had to work with. So, alright. Alright, so far side of the way. Alright, I'm going to come here and adjust it. I know my table normally might be a little bit longer. I'm just kind of making it work with what I got here. So, if you could, would you be able to please pull your feet towards you a little bit so your knees are bent, and then just have them relax at the sides? Perfect, thank you. Alright, first I'm going to grab this little piece right here, a little towel to give us a little absorption area. Block a little of the water, make sure your blankets don't get wet. So you just lift your butt up for me, thank you. In which case I would just set this right underneath. Have them sit right back down on it. Alright, perfect. And next, grab my sterile gloves. Keeping them off my sterile field and cross-contaminate anything of such. Alright, perfect. Banner cuff, skin to skin, glove to glove. Alright. Next step I would do is I'm going to lower my entire piece here. What I do is I would take it off here and set it onto the basically connect the two for the drapes here. That way increasing my field, but also again me ready in place. Again, it's not exactly the proper level, so I'll just kind of be adjusting them as fit here, but just so you're aware of. Alright, so I'm going to go ahead and get my supplies ready all here. Open these up. Alright, so next step is I'm going to be spreading the labia here. So I'm just going to feel a little bit of pressure as I spread. Okay, next what I'm going to be doing is taking these little swabs here. I'm going to be wiping one at a time, one side each. So I'm going to start on the left, up to down, toss in garbage. Right side, up to down, toss in garbage. And lastly, right down the middle. Okay. Next I'm going to grab the extra catheter itself, in which case this would be up closer here. Back and dunk in the lube. Alright, so this one. Alright, so next I'm going to be inserting the catheter here, so you're going to feel a little bit of pressure. Alright, here it comes. Put it up to the urethra. Insert till I start seeing some urine come through. Alright, next what I do is I push it in 1 to 2 more inches. And then I'm going to inflate the balloon. After this, I just pull very lightly back just to feel again to make sure that it's in the proper area. After that, I would use the strap that it should come with to secure the leg, or I could use, it says it's a tape on the instructions as fit. Next, what I could do is after that, I would secure that. I'll hang this off to the side of their bed properly, allowing it to drain. After that, next I could start clearing up my field. I've just move slightly again. So I'm just going to let this sit here as if it was secured. Start clearing up all my supplies. Next again I would use soap and water very lightly, and I would wash the sides of the perineal area, getting off any extra betadine. After that I would discard my gloves, and of course next wash again. Blankets will come back down over to cover properly and to provide privacy. Okay. After that then I would lower the patient's bed as to fit to the proper level, usually of course being about the lowest height possible. Raise the side rail again if needed. Afterwards I would ask, is there any other questions or any concerns you have that I can help answer before I get going here? Alright, nothing there. Okay, then I'm going to instruct you about any drinking and fluids and proper dining for that right now. And then of course if you have any questions about that, I can sure answer them for you right now about any fluids. No? Okay. Sounds good. Alright, well here's your call light. And again, make sure if there's anything else we can do, just let us know. Alright? Thank you. Have a wonderful day. And I'm going to go off right now to chart. But of course first I'm going to clean off my table, make sure all supplies are put away. Good to go. Hope you enjoyed the video.